Many people over time have wondered, does doing a bone marrow transplant in patients with ALL actually improve their survival? And there was a study that came out a few years ago that very importantly looked at patients who had MRD positivity and at the end of their treatment compared to patients who did not have MRD positivity. What they found that is an allogeneic stem cell transplant across all types of ALL did not benefit the patients who were MRD negative, but it did benefit the patients who were MRD positive substantially. So that study essentially has, and that's by Dedden et al. This study essentially has established the role of transplant with a significant improvement in survival in patients who have MRD positivity. Patients who go through chemotherapy do not have a high-risk subtype and who attain MRD negativity probably can avoid stem cell transplant. But of course, every patient should have a discussion with a transplanter and with their physician to determine the best course of action for themselves. I think it's also important to mention that the ability to give a stem cell transplantation has broadened and improved over time. It used to be patients had to be less than 60 years of age. We can do allogeneic transplants up to age 75 using reduced intensity conditioning. And we can also, even in patients who do not have a fully matched donor, we have new techniques where we can use mismatched donors. So the availability of transplant, our ability to do transplant safely and effectively has improved as well with time